but, you know, pediatrician says, you know, it's normal, he'll grow out of it. Or, yeah, you know, he's got allergies, but, you know, so do my other 3 kids, and my mom had them, and my dad had them, and, you know, or, yeah, I got heart disease, but, you know what, and high cholesterol, but my dad had it too, and so did my grandpa. Yeah, because, has anybody seen the Facebook post where it's like a doctor, and he goes, you know, the problem is not that heart disease and diabetes run in your family, the problem is that no one runs in your family? That's the context we're dealing with. If you can redefine normal in that parent's eye of saying, and they can get that light bulb moment and go, oh, shit, my kid is on the path to this, or I'm already there, and this chiropractic care, this adjustment, what you're telling me, that can get my kid back to normal, and normal, is that freaking awesome? They're going to tie into that, they're going to commit to you, they're going to pay you cash for that, and they're going to tell it. It's the world of Facebook. You get a kid with colic better, whose mom hasn't slept in 6 months, whose parents are supposed to be enjoying this beautiful, amazing kid, and yet their stress levels, their fight or flight's through the roof, and in 3 adjustments you get that kid better. You think she's going to get onto Facebook and maybe let a few other people know about that? Yeah. So guess what you don't have to do every Friday, Saturday, and Sunday? You don't have to be at Walmart and Sam's Club with your bilateral weight scales scanning and screening a bunch of, you know, grumpy-ass, low back pain patients and out there working all the time, okay? A pediatric practice is the #1 flipping practice you could build. Absolutely. All right.
Awesome. Say again.
That was the intro.
We got all day. Does anybody have any questions
on that? How much time you guys got left?
Yeah, we have a little bit. We have a decent amount.
Sounds like
okay.
Yeah.
All right.
So as far as you want to go.
Well, yeah, no, yeah, I've got up 10 to 15 minutes that I can hang out here. So questions on the subluxation process, the birth process, any of that?
Well, I just have a quick question. Because parents are getting smarter, do you have the mom that comes in that says, you know, I had the natural birth, my kid's never been vaccinated, we eat healthy, they're doing all that, and they're like, still something wrong. So, like, where do you go with that? Because
yeah, I got it. Yep. You know what? That's a great one, and what I've always found to be a very powerful way of answering that question. And I kind of lead into it with this. If that mom, you know, she's probably there, and if she's doing all those things, she understands that she wants her child to be at 100%, not just average. So one thing that we use all the time, and with our wellness patients, with families like that, is we'll say, okay, well, I've taught you the subluxation, and you understand what that is and what it does. And so let me ask you this. If we say we rank the subluxation on a scale of 1 to 10, 10 being the worst, 1 being, you know, the least intrusive sort of subluxation. What we know, based upon neurophysiology, is that subluxation probably has to get to at least a 4, 5, or 6 before it's going to cause symptoms, before you maybe see your kiddo have an ear infection, get a cold, be constipated, or any of those sort of issues. So what we are able to do in our office, and again, we use the substation scans. If you get into practice and try and build a pediatric practice without the subluxation station, again, I will hunt you down and knock you upside the head because, again, it shows all the other Ds. This is a show me iPad society. They're used to metrics and graphics and analysis. You need to be able to have a picture. You need to be able to have something to show them and relate it to. So what we'll say to that parents, we'll say, okay, the beautiful thing about the way we practice is both through my examination and through my scans, I can find that subluxation when it's a 1 or a 2 before it's done any damage, before it's led to any issues, and I can correct it when it's a 1 or a 2 and a 3 or 4, and that gives your child the greatest chance to never go down that road, and it gives your child the greatest chance of really living life to the max, having that optimum function, being just that full throttle, living in the green zone, as we like to call it. So would you rather us wait until it gets to a 5 or a 6 and there's kind of expressions or symptomatic signs of it, and then have me fix it and correct it? Or would you like me to kind of check and see now if there's that in there? And whatever level it's at, I'm going to tell you exactly what I found. I'm going to tell you exactly what it takes to get rid of it, and we'll put a plan together to make sure we do and we keep them healthy. And every single time, parents will really dive into that, and they'll go, okay, well, that makes sense. Because, again, what they got to understand, and this is truthfully for adult patients, too, this stress, our body has an amazing ability to adapt to stress. It's when it gets overrun is when it gets symptoms and when it gets expressions. And we're very much trained to be a reactive society, and even that mother. But that's the sort of mom, if they chose to have a natural delivery, if they chose to not vaccinate, they're gonna kind of dial into that mode of conversation anyways, because they probably made those decisions to say, hey, I want to give my kid the best chance. I want to avoid all this other sort of stuff, and I know how that relates. So you just want to plug right into that same level of thinking that mom has, that caused her to make those other wonderful decisions at the same time. And I always honor, always piggyback on that, always say, yeah, you did all those other amazing things. Let's just add to it. See, chiropractic adjustments are, and we say this all the time with our patients, we can't, we also run, being a wellness guy, we basically have two practices in one, really kind of three. We have our spectrum practice, which is where we really take care of the most challenged seizures, autism, sort of kids. That's probably about 30 to 40% of my practice. And then we have our 8 weeks to wellness, then we have our general family practice, where basically the family doctor, families come in 4, 5, 6 at a time, all get adjusted, weekly adjustments. They come to us at any sign of illness or issue first and let us take care of it. And then we run 8 weeks to wellness in our office too, which is a very much functional, where they get personal training, we get nutrition, they learn how to eat paleo, all that stuff. But where I'm going with this is I will always tell a patient, I'll say, you know what? If I could just make an adjustment for you or make an adjustment for your child, and you could still be perfectly healthy by eating cheeseburgers, smoking cigarettes, and sitting on your ass all day, I would charge you 10 times more for that adjustment than I charge you. So what I need to do is make sure that we get that adjustment, because it's as important, if not more important, than everything else that we can teach you. But you got to do it all in unison. And real quick, while I'm on that, this is an important thing. So you're gonna all build a wellness practice. That's another, pediatrics is really catching storm in our profession, which is freaking awesome. The wellness is already kind of caught storm. What I want to teach you on that too, and again, it's a little bit of an aside. The tricky thing you have to do to really build a wellness practice, and depending on where you are in school and where you are in your chiropractic understanding, you probably all heard the friggin' argument of straight versus mixer, and Sid Williams in the hands, and all of this, BJ, and it's a whole complex, stupid argument that us chiropractors just like to get into. But if you're going to have a practice where you want to bring other sort of things into, you want to teach people how to eat well, move well, and think well, what I'm going to tell you is you still have to have, how do I want to say this, a pretty straight basis to the way you handle your care and the way you communicate. Because what will happen is, if you come into practice and the way you teach it and practice it, if you kind of put chiropractic on the same playing field as massage and nutrition and personal training and all these other wonderful things that we all should apply in our life and in our patient's life, if you kind of teach it that they're all on the same playing field, the problem that's going to occur with that is that because society has a pretty negative brand equity of what chiropractic is, or at best they don't really have a freaking clue whatsoever, but they do know about nutrition, they do know about exercise, and massage is even a pretty popular thing these days. What will happen is their viewpoint will bring chiropractic down a notch or two, and it will layer it below under the hierarchy of those other things, and that patient will they'll love you for being their source for this, that, and that, but